Talked a little and you told me what you would like, and I kind of agree exactly with what you said. You've got a little hump here.
Yes.
So we're going to file that down just gently. It doesn't need to go down very far, just that little teeny hump. I think the base of the nose here needs to come in just a little bit. The tip of the nose is like mine, not as bad, but it's called bulbous. So I have to make that a little more delicate. I also need to bring this angle up. I need to bring your angle up because when you smile, you have a 0-degree angle. So and I'm talking about millimeters. Elevate this a little, bring this base in a little, make this tip a little more delicate, file this down. Then after I'm all done, I'll look at it. Sometimes I'll narrow the base here.
Okay.
Not sure you need that. But when I'm all done, then I determine that part.
Okay.
All the rest, I definitely will do.
What about the size of the nostrils?
You can't change that.
Okay.
That's a circle
just the way
in
it
that
is.
one. And it won't look that bad once the whole nose, illusion-wise, it looks bigger because the nose is bigger. But when the nose becomes smaller, that even matches better.
Okay.
Takes about an hour to an hour and a half. Then you go to recovery room. Then you go home to Papa, and he has breakfast in bed and foot massages for at least a month.
Perfect.
Mandatory.
Okay, got it.
And that's it.
That's it. And then the complications?
Complications are anything from death, which I've never seen in my practice, infection, which again, I've never seen one. And I think the key is success, okay? Your expectation. If your expectation far exceeds my capabilities, you're not a happy camper.
Right.
So is that a complication? No, but there's a miscommunication maybe.
Yes.
And I want you to be realistic.
Right.
I showed you a rendition that you could potentially look like. Will you look exactly like that? No. You may be even a little better, or you could be a little less dramatic than that.
Okay.
Will it be an improvement? Of course.
Yes. All right.
Questions?
Recovery time?
Recovery is about, first of all, you're in the recovery room for about 45 minutes, and then probably has to take you home.
Okay.
Once you do that, you have your head elevated, you put ice, you take it easy for about a week. I take the split and the cast and the sutures out in about 6 to 7 days. You'll look pretty good, but where you want to go out to dinner and have a nice evening with a hubby and a little glass of wine, probably 10 days post-op.
Okay. So hide for 10 days.
I mean, so many. This is Newport Beach, okay? This is Southern California. You see people riding in a car with a cast on. Well, you know they didn't break their nose. They had a nose job.
Right.
So today, I mean, people aren't, in this day and age, people aren't shy anymore. You know, you have to understand that 25% of these people are having some kind of surgery, whether it's breast surgery, nose surgery.
Well, I live in North Orange County, so that's
North
a little different.
Orange County. I live in the farthest north Orange County possible. I live in Huntington Beach.
I live Stanton, Anaheim.
Okay, so you're northeast.
That's a little,
so you're what, that
different.
way. Okay. Well, we're on the periphery of the rat race. So, but still, I mean, people online today, they read reviews, and you well know. I mean, they're chatting, they're talking. So it's not like 25 years ago. Everybody knows what's going on in the world today.
And besides, I'll be sharing it. So
yeah, of course.
definitely.
Yeah.
All right.
All right.
All right. Thank you so
Very
much.
nice meeting you.